If you've just given birth, I want to say congratulations to you and your baby. So, in today's video, I'm going to be talking about essential newborn care tips that mothers need to know about how to care for their newborn. Essential newborn care involves providing a safe and nurturing environment for the newborn's physical, emotional, and developmental needs. So in today's video, we're going to be highlighting some important tips that every new mom needs to know. So now let's dive into the first few hours or minutes of your baby's life. In the first few hours or minutes of your baby's life, you need to create bonding with your newborn, and that is the reason why skin to skin contact is very important, except in cases whereby your newborn needs special care or you yourself as a mother needs special care. And in a case whereby none of this is involved, skin to skin contact is very important. It promotes bonding and it also helps to regulate your baby's body temperature. So after that, breastfeeding is initiated. Yes, immediately you need to put your breast inside your baby's mouth. This helps to produce more milk and also helps to release antibodies into the body of your child, because the first breast milk that comes out of a new mom's breast is very important. It is called the colostrum. Very important for your baby's developmental needs. Then lastly, for the first few hours of your baby, you don't have to hand over your baby to any healthcare provider. Make sure that your baby is right beside you. Let your eyes be within the reach of your newborn. We have had cases whereby hospitals swap babies. Yes, it's true. We've had several cases whereby hospitals swap babies, and maybe in future time, and the man wants to do a DNA test. There might be some problems. You feel like, oh, this woman cheated on me before we got married or something. No, let your newborn be close to you. Keep an eye on your newborn, except if there are complications. Maybe you had some complications while birthing your newborn. Have your family member close to you, maybe your husband or your close family member, that will keep an eye on the baby. So that is that for the first few hours of your newborn's life. Then after you are discharged, maybe you are discharged and you are at home, there are some tips you need to know as a mom. There are some things you don't need to do so that you will not cause problems for your newborn. First of all, you have to maintain breastfeeding regularly. This will help to keep your child healthy, except in cases whereby your breast does not produce enough milk and you want to introduce formula. Mind the kind of formula you will give to your babies, because some babies are lactose intolerant. They don't tolerate lactose. This will result into diarrhea in your newborn. So make sure you always monitor your newborn. Check for changes in your newborn. Initiate breastfeeding regularly. Breastfeed your baby regularly. This will help keep your baby healthy. And another tip is, when you are bathing your baby, make sure that you use mild soap and warm water. You don't need to use harsh soaps on your newborn's body because their body is still developing. You need to use mild soap. Then another tip is, avoid kissing your baby. Do not allow anybody kiss your baby, because we all know that in our mouth there are a lot of bacteria and the newborn's immune system is still not fully developed. So avoid putting your mouth inside your baby's mouth or allowing any of your relatives to put their mouth inside your baby's mouth. Avoid that. Make sure that if you are introducing formula for your baby, the water, is it water bottle or feeding bottle, yes, sorry, the feeding bottle should be properly cleaned. The feeding bottle should be properly washed, properly cleaned, to avoid the spread of infection to your newborn. Make sure that you use hot water in sterilizing your baby's feeding bottle so that your baby will not catch an infection. Then for cleaning your baby's umbilical cord, I have made a video on how to care for your newborn's umbilical cord. Do not use any hot thing on your newborn's umbilical cord. If you want to clean your newborn's umbilical cord, Just use cotton wool and warm water, sterile water. Clean your baby's umbilical cord and then apply the chlorhexidine gel on your newborn's umbilical cord. It will help protect your newborn's umbilical cord from infection and also helps it to get dried on time. Then make sure that you always keep appointment with your doctor by ensuring that your newborn's immunization schedule, you don't miss it out. You don't miss out on your newborn's immunization schedule. I've made a video on immunization and its benefits on various kind of vaccines that your baby will need at every stage of their life. Make sure you don't miss vaccinating your baby. Vaccination is very, very important as it will help to curb the spread of infection to your child and also help to prevent diseases from affecting your child. Make sure that you monitor your baby's growth. There is something that they call the mid upper arm circumference, also known as Shecker strip. It is used to check if your baby is malnourished or not. Always make sure that your child is checked with this strip in the health facility and also monitors your child weight. This will help to know if your child is gaining weight. Maybe your child is feeding well. If your child is feeding well, definitely your child will gain weight. But if you always monitor your baby's weight, you will know when your child is feeding well and when your child is not feeding well. So this will help you to know the right nutrition that you can give to your babies. So these are the tips that you need to know in order to care for your newborn. I've hoped that you learned something today about essential newborn care. So that is all for today. Newborn are still growing, they are still developing. Don't introduce things anyhow to them. Before you introduce anyhow things to them, consult your doctor and make sure that you monitor how your baby behave in order for you to quickly detect for any sign or any changes. If your child develops fever, temperature that is above 38 degrees Celsius, please rush and consult your healthcare provider. Thank you guys for watching, and please don't forget to subscribe, comment, like and share this tip to somebody you know might find it helpful. Thank you all. Bye.